Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. Hi, Dr. Normington. How are you today?
Great, Jordan.
Good. So today I wanted to discuss a procedure that you do specifically in the office here, rhinoplasty.
Sure.
Can you explain to me who is a good candidate for that and how that procedure is performed?
Right. So a rhinoplasty is a whole variety of procedures designed to improve how the nose looks. Mm-hmm. Okay. So there's different kinds of rhinoplasties. Some rhinoplasties are more extensive and they involve reshaping the bones in the nose. And some rhinoplasties are more minor, that they might involve just simply reshaping some of the cartilage areas of the nose, like for instance, the tip of the nose. They're a little less involved and have a little bit of an easier recovery generally. Yeah,
okay.
So there's different kinds of rhinoplasties.
Right.
Yeah.
So for someone who maybe has like breathing issues or anything, but also doesn't like the appearance of their nose, is that something that you could help them with, or would you refer them to an ENT doctor?
Right. So we often work in conjunction with ENT doctors. Well, ENT doctors are a little better trained at diagnosing some breathing problems. Mm-hmm. So generally, I would recommend, at least exploring an evaluation with an ENT doctor. They have some special techniques to look at some of the deeper areas of the nose to see what's going on. But with a rhinoplasty, we do often address some breathing problems. I think most commonly, we'll look at addressing a deviated septum. So the septum is the lining of the nose, and some folks, it can bend or deviate, obviously. And then as it does, it can interfere with some of the breathing or passage of air on one side. And we'll be able to address that at a rhinoplasty. Or sometimes we'll address something called the turbinate, which is a little deeper in the nose. It warms the air that we breathe. They often can become enlarged, and we'll be able to reduce those in size with a rhinoplasty. So generally in our practice, if you're just having breathing problems, you're probably better suited seeing an ear, nose, and throat doctor because that's more their specialty.
Right.
But if you're interested in changing the appearance of your nose, we're eager to see you. And then if there are some breathing issues, there's potentially we could address those at the same time.
Yeah. So can you explain to me exactly how you perform that procedure? Like I know you said it's kind of removing and breaking down of the cartilage, but where do you make incisions? How do you access the cartilage?
Sure. So usually most rhinoplasty procedures are with incisions inside the nose. So we try to hide the incisions. The surgery is all done up through the nostril most of the time. There are some exceptions where we'll do some other incisions maybe around the bottom of the nose where the scar isn't seen so much, but it's all hidden up in the nostril generally, so there's no external incisions or scars on the outside when we do this sort of surgery.
Okay,
yeah.
Great.
And it really kind of depends what we're doing. If we're I think most rhinoplasties we're usually addressing the nasal bones, the bones that can become often enlarged and they need to be reduced, and we're reducing the size of those bones. But that's all done, up inside the nose itself.
Okay.
Yeah.
And could you perform a sort of rhinoplasty that addresses just like the size of someone's nostrils? Is that a possibility?
It's possible to make the nostril a little smaller. Most commonly, we're reducing the tip of the nose. The tip of the nose can become bulbous, and so we're commonly making that smaller to make the tip of the nose more defined and more feminine. Often, to make it more pleasant, like your nose, Jordan. You have a great nose.
Thank you. And so what sort of like recovery is that like, and what sort of anesthesia is that even done under?
Yeah, so usually if we're doing a full rhinoplasty, people are having anesthesia. Mm-hmm. If it's a little something in the tip of the nose, we often can perform that with local anesthesia, but generally you're probably going to have some anesthesia. The good news is the recovery isn't so bad. There's not that much pain involved typically. Mm-hmm. Some stuffiness of the nose is common, so you get all stuffed up, and it's kind of like having a sinus cold for a few days because the sinus passages tend to swell up a little bit. Mm-hmm. Some rhinoplasties, we do put a little splint on top of the nose to protect the nose for about a week. Some rhinoplasties involve a little bit of bruising, around the lower eye or cheek area. But most people, in a week or so, maybe with a little makeup, they're back working and socially, presentable.
Right. Yeah. And is this a procedure that can be covered by insurance, or is it strictly cosmetic?
So sometimes an insurance company could become involved if we're addressing some breathing problems. But any type of procedure where you're changing how the nose looks, that portion at least is usually not covered by insurance and is something that the patient is responsible for.
And how much would you say a patient could pay for that procedure then?
Yeah, so a rhinoplasty, there's a big range. A small rhinoplasty just in the tip of the nose, that might be in the mid $2,000 range. A full rhinoplasty, you're probably looking at something approaching the $7,000 range.
Okay.
Yeah.
Great. Well, thank you so much.
Well, thank you, Jordan.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.